Quality sleep becomes increasingly essential as we age, functioning as a fundamental pillar for overall health and longevity. Unfortunately, many elderly people unconsciously adopt nighttime habits that can significantly compromise their health, quality of life, and safety. This in-depth guide explores 4 common bedtime practices that pose considerable risks for people over 70, presenting practical alternatives endorsed by geriatric and sleep medicine specialists to promote more peaceful nights and comprehensive well-being. 1. Avoid heavy meals before bedtime, a digestive challenge for senior body. With aging, significant physiological changes occur in our digestive system. Metabolism naturally slows down, digestive enzyme production decreases, and intestinal motility becomes less efficient. Consuming substantial meals close to bedtime can trigger a series of negative effects that are particularly problematic for the elderly. Detail potential risks. Intensified acid reflux and heartburn. When lying down with a full stomach, the lower esophageal sphincter, the valve that separates the stomach from the esophagus, becomes more susceptible to allowing stomach acid to return to the esophagus, causing burning sensations, nighttime coughing, and intense discomfort. Sleep fragmentation from digestive discomfort. The active digestive process keeps the body in a state of physiological alertness, preventing natural progression to deeper, more restorative stages of sleep. Elevated heart rate at an inappropriate time. During normal sleep, heart rate should decrease as part of the cardiovascular system's recovery process. Active digestion increases blood flow to the digestive system, keeping the heart working at a faster pace. Increase blood pressure during sleep. Studies show that digesting heavy meals can raise blood pressure by up to 10 to 15 millimeters of mercury during the first hours of sleep, a period when a natural nighttime dipping of pressure should ideally occur. Increased risk of nighttime cardiovascular events. The combination of elevated pressure, increased heart rate, and possible hypoxia, low oxygen, related to respiratory problems can create conditions conducive to arrhythmias, nocturnal angina, or even ischemic events during sleep. Potential for aspiration and pneumonia. Reflux of stomach contents can, in severe cases, be aspirated into the lungs during sleep, especially in elderly individuals with reduced cough and swallowing reflexes, leading to aspiration pneumonia, a condition with a high mortality rate in the geriatric population. Glycemic fluctuations during the night, particularly concerning for elderly people with diabetes or prediabetes. Late meals can cause glucose spikes followed by sharp drops, reactive hypoglycemia, which can manifest as nightmares, night sweats, or even mental confusion upon waking. Healthier alternatives and practical strategies. Adopt the nighttime fasting principle. Establish a window of at least 3 to 4 hours between your last substantial meal and bedtime, allowing an intense digestive process to occur while you're still active. Reorganize your meal schedule. Consider adopting the Mediterranean model, with lunch as the main meal of the day and a lighter, earlier dinner, preferably before 7 p.m. Suitable options for small nighttime snacks. If you feel hungry before sleep, choose alternatives that promote sleep without overloading digestion. A small portion of walnuts or almonds contains magnesium and tryptophan, precursors of melatonin. Half a banana, rich in potassium and magnesium, which help with muscle relaxation. A small portion of cottage cheese with some berries, slow-digesting protein plus antioxidants. A cup of chamomile, lemon balm, or lavender tea, scientifically proven calming properties. Elevated position for sleeping. If you occasionally need to sleep after a more substantial meal, elevate the head of bed by 15 to 20 degrees to reduce the risk of reflux. 2. Properly manage fluid intake during the evening. Adequate hydration is essential at any age, but requires a strategic balance in later years. Excessive fluid consumption close to bedtime can trigger significant problems for the elderly, affecting both sleep quality and safety. In-depth potential risks. Frequent nocturia, nighttime urination after 70. The bladder capacity to store urine decreases significantly, from about 600 milliliters to 200 to 300 milliliters in many cases, while the kidneys continue filtering blood throughout the night, resulting in urinary urgency even with moderate amounts of fluid. Severe disruption of the sleep cycle. Each awakening to use the bathroom can require up to 90 minutes to return to deep sleep, if possible at all. After 3 or more interruptions, restorative deep sleep, stages 3 and 4, may be completely eliminated, Multiplied risk of nighttime falls. Statistics show that more than 40% of serious falls in the elderly occur during nighttime trips to the bathroom, frequently resulting in hip fractures, which have a 25% mortality rate in the first year after injury. Postural hypotension when rising quickly. The sudden change from lying to vertical position can cause drops in blood pressure up to 30 millimeters of mercury systolic, resulting in dizziness, darkened vision, and risk of syncope, fainting. Disruption of melatonin production. Exposure to light, even dim light, during bathroom trips suppresses melatonin production, an essential hormone for sleep maintenance with antioxidant and anti-inflammatory properties fundamental for healthy aging. Cognitive impact of chronic sleep fragmentation. Longitudinal research demonstrates that elderly people with frequent awakenings for nighttime urination show accelerated cognitive decline, with up to 3.4 times greater risk of developing mild cognitive impairment, MCI, and dementia over 5 years. Electrolyte imbalance due to compensatory dehydration. Many elderly people, trying to avoid nocturia, drastically reduce their overall fluid intake, leading to chronic dehydration and imbalances of sodium, potassium, and other essential electrolytes. Healthier alternatives and balanced approach. Timed hydration. Concentrate 70% of daily fluid intake in the first half of the day, following the decreasing rule. Larger volume in the morning, moderate in the afternoon, minimal at night. Nighttime microhydration technique. If you feel thirsty at night, use small sips, 15 to 30 milliliters, instead of full glasses, allowing hydration without overloading the kidneys. Strategic elimination of natural diuretics. Avoid not only caffeine, but also other less known natural diuretics, such as ginger, hibiscus, dandelion, and certain herbal supplements in the hours preceding sleep. Monitoring hidden fluid sources. Pay special attention to foods with high water content, such as soups, watermelon, orange, pineapple, and melon, which can significantly contribute to nighttime urine volume. Light compression of lower limbs. For people with a tendency toward edema, swelling in the ankles during the day, using light compression socks until bedtime can help redistribute this fluid, reducing nighttime urine production. Consider the elevated position technique. Slightly elevating the legs 30 minutes before sleep can help mobilize fluid accumulated in the lower limbs, allowing it to be processed by the kidneys before sleep begins. 3. Maintain a sleep environment with appropriate temperature. Many elderly people prefer warmer environments due to changes in body thermoregulation and reduced peripheral circulation. However, sleeping in excessively heated rooms can create unexpected health risks, especially after age 70. Detail potential risks. Cardiovascular overload for thermoregulation. With aging, the cardiovascular system already works with reduced functional reserve. Excessive heat during sleep forces the heart to pump more blood to peripheral vessels as a cooling mechanism, increasing cardiac workload by up to 25% during a period that should be for recovery. Insidious dehydration from night sweats. Even mild episodes of sweating during sleep can lead to the loss of 500 to 700 milliliters of fluids during the night, often without conscious perception, contributing to chronic dehydration. Hemoconcentration due to mild dehydration. Fluid loss leads to increased blood viscosity, with elevation of hematocrit and concentration of coagulation factors, creating conditions conducive to microthrombus formation. Potentiated risk of thromboembolic events. The combination of normal venous stasis during sleep, hemoconcentration, and possible dehydration significantly increases the risk of deep vein thrombosis and, consequently, pulmonary embolism. Interference with natural circadian rhythm patterns. Reduction of core body temperature by approximately 0.5 to 1 degree Celsius is a crucial physiological signal for the onset and maintenance of deep sleep. Very warm environments make this natural thermal reduction difficult. Compromise of the most restorative sleep phases. Slow wave sleep, stage 3 to 4, and REM sleep are particularly sensitive to elevated ambient temperature, with reductions of up to 50% in their duration in environments above 24 degrees Celsius 75 degrees Fahrenheit. Morning fatigue and daytime cognitive impairment. The reduction in sleep quality caused by excessive heat manifests as tiredness upon waking, difficulty concentrating, irritability, and even symptoms similar to brain fog. Healthier alternatives and thermal comfort strategies. Ideal thermal zone for geriatric sleep. Keep the room temperature between 15.5 degrees Celsius and 19.4 degrees Celsius, 60 to 67 degrees Fahrenheit. Consider the ideal range by sleep medicine specialists for elderly people. Adaptable layer system. Instead of a single heavy blanket, use a layer system with multiple light coverings that can be easily removed or added during the night without fully awakening. Careful selection of fabrics for sleepwear and bedding. Opt for organic cotton, linen, bamboo, or specially developed synthetic fabrics with thermal regulation technology. Avoid flannel, wool, and conventional synthetic materials that retain heat and moisture. Microclimate strategies for extremities. Many elderly people have cold hands and feet due to compromised peripheral circulation, but overheat their entire body to compensate. Use light cotton socks and specific silk gloves for sleeping, allowing you to maintain a cooler environment. Optimization of air circulation. Use ceiling fans at low speed to create gentle air movement without direct drafts. Consider air purifiers with circulation functions that simultaneously improve air quality and promote discrete atmospheric movement. Pre-sleep preparation for thermoregulation. A warm, not hot bath 60 to 90 minutes before sleep induces vasodilation, naturally followed by body cooling, signaling to brain that it's time to initiate the sleep process. Adaptive temperature technologies. For specific cases, consider mattresses and pillows with thermal regulation technologies that absorb body heat when excessive and release it when necessary. 4. Adopt the ideal sleep position for the senior body. The way we position our body during sleep becomes increasingly relevant with advancing age, directly impacting respiratory, circulatory, and digestive systems. For people over 70, sleep position is not merely a matter of preference, but a determining factor for health. Detailed potential risks of inadequate positions. Airway compromise in the supine position. On the back, the natural relaxation of muscles during sleep, combined with the age-related loss of tone in oropharyngeal tissues, causes the tongue and soft palate to recede, reducing the airway diameter by up to 30 to 40% in this position. Undiagnosed sleep apnea due to oropharyngeal tissue relaxation. Studies show that more than 60% of men and 40% of women over 70 have some degree of obstructive sleep apnea, often undiagnosed, with episodes of oxygen desaturation that can reach levels below 85%, intermittent hypoxemia, and cellular oxidative stress. Each apnea episode causes a drop in blood oxygen levels and subsequent reoxygenation, generating free radicals and promoting systemic inflammation, accelerating cellular aging processes and neurodegeneration. Cardiac overload in right lateral decubitus. In this position, the heart, especially the right ventricle, is compressed by the weight of the mediastinum and right lung, making adequate filling of the cardiac chambers difficult and reducing cardiac output by up to 15% in the elderly. Compromised circulation and venous stasis. The natural decrease in vascular elasticity and venous valvular function with aging is aggravated by positions that hinder venous return, contributing to edema, varicose veins, and increased risk of thrombosis. Potential for pulmonary fluid accumulation and edema in people with heart failure, even mild or undiagnosed. Sleeping in inadequate positions can facilitate fluid accumulation in the lungs, manifesting as nocturnal dyspnea, dry cough, or orthopnea, worsening of gastroesophageal reflux and aspiration risk, lower esophageal sphincter incompetence, common in the elderly, combined with positions that increase intra-abdominal pressure, significantly raises the risk of nocturnal microaspirations associated with recurrent pneumonias and pulmonary fibrosis. Healthier alternatives and optimized positioning techniques. Prioritize the left lateral decubitus as the primary position. This position offers multiple proven physiological benefits, facilitates venous return to the heart, reduces pressure on the right atrium, prevents compression of the inferior vena cava by the liver, minimizes gastroesophageal reflux through favorable anatomical positioning of the stomach. Use strategic postural supports. Elongated body pillow that follows the body's curvature from head to knees. Pillow between the knees adjusted to hip width to maintain pelvic alignment. Small lumbar support to fill the space between the waist and the mattress. Optimize elevation of head and trunk. Use 10 to 15 degree elevation for the entire upper half of the body, not just the head. Consider adjustable beds or specially designed elevation wedges to distribute weight evenly. Positional anchoring, techniques to maintain position during sleep. Strategically positioned lateral pillows. Sleepwear with side pockets for insertion of small tennis balls. The physical barrier technique. Light positional feedback devices that gently vibrate when the sleeper assumes inadequate positions. Considerations about support surfaces. Mattresses of adequate density that allow moderate sinking of hips and shoulders, pressure zones, while maintaining support for waist and spine. Ergonomic pillows with specific design for adequate cervical support in lateral position. Daytime strengthening program. Specific exercises to strengthen the oropharyngeal musculature, tongue, and upper airway, proven effective in reducing respiratory problems during sleep. Small adjustments to your nighttime ritual can have a significant impact on sleep quality and health risk reduction as we age. Implementation of these changes should be gradual and personalized, carefully observing how each modification affects your rest and overall well-being. Start by incorporating one change per week, giving your body time to adapt. Keep a simplified sleep diary to record changes in rest quality, morning energy, and any symptoms such as pain, discomfort, or the need to get up during the night. Remember that healthy aging doesn't just mean prolonging life, but optimizing the quality of each phase of it. Restorative sleep is fundamental in this process, functioning as a foundation for cognitive, emotional, and physical health during the later years. Always consult healthcare professionals when implementing significant changes to your routine, especially if you have pre-existing medical conditions or use medications that can affect sleep. The goal is to create an individualized plan that respects your specific needs while incorporating the fundamental principles of sleep hygiene for the elderly. With small, consistent steps, it's possible to transform your sleep and, consequently, your health and quality of life in the golden years.